The current case numbers is 6,720 confirmed coronavirus cases in Australia, still 83 deaths, unfortunately, but our continual positive trend of low case numbers continues. So over the last week we've certainly seen daily numbers that were significantly lower than the previous week, but as I've also said on many occasions, the fact that we have still picking up new cases means that we obviously cannot be complacent. Someone was asking about the number of hospitalised patients. There are 113 people in hospital at the moment, 43 people still in intensive care and 27 people currently receiving support from ventilators at the moment, and those numbers again have come down significantly over the last few weeks. So, and as you also know, there are some jurisdictions in Australia that have had no new cases for some days. So our suppression strategy is working well. Our focus at the moment, I've said this on many occasions in many press conferences, is to build our public health capacity. We've just had a meeting of the Health Protection Principal Committee where we're talking about significantly expanding testing across the country, including for the first time we'll be starting some tests in asymptomatic people to try and be absolutely sure that we are capturing every case that we can and that we're not missing cases. We don't think we are missing significant numbers of cases in Australia, but if we're going to consider at the National Cabinet in a few weeks' time any relaxation of distancing measures, we have to be so well prepared. Part of that preparedness is the app. Really excited that over 1 million Australians downloaded it just in the first evening. That is an amazing and really gratifying outcome. I'm so proud of my fellow citizens. Not only did I and my family, but every doctor and every staff member I know download it. And I'm sure every journalist in the country download it because they're all great citizens too. But that's really exciting. And today we're having continued further uptake. And I'm hoping that we'll get even higher. Minister Hunt's going to make some announcements later on, but I'd be pretty confident we might be beating yesterday's performance if we keep going. It's been really great, the uptake by the Australian community, because they know that this is about protecting them. It's about helping our public health officials do their job, and that's all it is. And that it is a no-risk, highly secure, very safe app. And I've said on many occasions, including yesterday, that the more Australians that take this up, the more secure we are about our public health response, and the more secure National Cabinet will be about thinking about taking those gentle, cautious steps that we want to take, we all want to take, but no one in Australia wants to risk a situation occurring here like we've seen in many other countries with widespread transmission. We must keep our community safe, and this app is about doing that. I'll stop there and take questions, and if there's any questions on the app, Daniel is here to answer them if they're technical questions. So,
Professor, if you want to ask about community transmission, this unknown the number of people who are with no link to where they get it from.
Yep.
In New South Wales, we've seen just 15 in the last week.
Yep.
Over the course of the weekend, we've seen people out and about across the country in beaches and parks,
yep.
shopping centres again. What's your message to those people? And how hard is it to actually catch coronavirus in Australia if just 0.01% of the population has the virus? So,
obviously, the lower the numbers and the better the testing, it's more difficult to catch it. But we have seen outbreaks of 35 people from one case in a wedding. It is highly infectious. So if you have someone particularly who we believe sheds a lot of virus, what we call a super spreader, that sort of person can infect a lot of people very quickly. And that's why Even though we may have very low numbers of cases, we want everybody to practice social distancing, even if we release restrictions in the future. People need to change the way they interact permanently, until in the sensible way, like keeping distance away from each other, hand hygiene, probably not permanently not shaking hands, but certainly for the foreseeable future. If we're going to relax these distancing measures, the things that we've closed, we have to change the way we interact as human beings until we're through this virus.
How then, in terms of if you're looking at easing those restrictions, what's your formula, what's your thinking behind the community transmission? It's obvious that's the area that you're most concerned about now.
Correct.
Is there a number, a percentage of what you're looking at?
No, there is. It's all about trends. Clearly, if you've got less than 1% growth in cases is where we are at the moment, that's a good trend. Clearly, if you had no community transmission, as we've seen in some states, that might mean that some states might feel the need to relax things a bit more quickly. That might mean that's part of the reason why some states have been much more forward-leaning in reopening schools. So,
does that concern you, though, if people's states are moving faster ahead of other states?
Not necessarily if their epidemiology is different in those states. We've always set, National Cabinet always set what we called a baseline. And beyond that, some states went harder when their epidemiology was different, and beyond that, some states have now relaxed when their epidemiology is different, but they're still within that National Cabinet agreed baseline, and National Cabinet agreed to a set of parameters with which they could operate.
Professor Murphy, just in terms of testing asymptomatic people, how would you figure out who to test and what are the groups that you're considering?
So we haven't reached final decisions on that, but clearly a high priority would be health and aged care workers, because they're at the front line. They're the people probably most likely to see cases, and they're very representative of the community. And obviously the consequences of a health and aged care workers getting asymptomatic infection would be high. So we've had talks with the leading professional bodies, the AMA, the ANMF and others, and they're very supportive of the idea of voluntary, what we call sentinel testing. You can't test everybody. There are too many of them. There are 300,000 nurses in Australia. So you would test people on what we call a sampling or sentinel basis. We're still working through all that. I know the Victorian Premier just announced today that they want to test a lot of people in Victoria, and we certainly believe that they're keen to focus on health and aged care workers in the first instance, but there are others as well.
Professor Murphy, a number of aged care peak bodies this morning called for the AHPPC to retroactively almost back their measures preventing all visits to aged care centres. What's your response to that request, and more broadly the idea that a lobby group is asking health officials to change their scientific advice to suit what they want to do?
Sure. So AHPPC's advice remains the same. We believe, and we have updated our advice to say that there are some circumstances, such as if there's an outbreak in a facility, or if a facility is in a community where there is a significant community outbreak, then it may be reasonable to restrict visitors. But beyond, and that doesn't exist anywhere in the country at the moment, but beyond that, we believe that it is possible and in the best interests of the residents to allow highly screened, safe, limited visitors. And our recommendation is that there should be no more than 2 visitors a day, and they're obviously the very important close contacts of the resident, and that they should be screened. Everybody coming into an aged care facility needs to be screened. Staff, visitors, anyone else coming in, they need to be well. Nobody should enter an aged care facility if they've got a cough or a cold or a runny nose or a fever. So that's the important thing, is to make sure that everybody coming in is screened, and that visits are short duration in a safe environment. So we have not changed our advice, and we won't be changing our advice. We understand that the aged care sector, many of the providers took these measures on what they believe to be in the best interests of the residents, but we think that has to be weighed up against the mental health of the residents as well.
Professor Murphy, a question for you first and also for your colleague. Two NRL players have appeared to have breached restrictions. What do you make of their behaviour, and would that have any effect on the NRL's determination to return?
I'm not aware of the circumstance of that, so I really can't comment on.
Well, they went on a camping trip.
Well, I think anybody. It's disappointing when anyone breaches restrictions, but the behaviour of individuals shouldn't interfere with a holistic assessment of any proposals we might get in the future.
For Mr. Keys.
Yeah, you can have a question.
Why did Australia release its own app before waiting for Apple's version?
Apple and Google are working on partnership of introducing a native function to perform contact tracing. Now that's some way away. It's been rumoured to be sort of late May, but there's no definitive date for release. So we moved forward to provide a capability that can support the government's sort of agenda to allow us to then introduce a capability that we can then build on when the Apple and Google functionality comes in. I'd also like to add that capability that's being built into their operating systems will only be available to those people who upgrade. Now, for some people, the phones will not handle an upgrade, so we need to cater for a sort of, I guess, a diverse range of users out there and provide solutions for as many people as possible.
In terms of that capability, sorry, just from a technical point of view, would that mean that, for example, iPhone users wouldn't need to have that app permanently open in the background, or do you know?
It's unclear at this stage, so we're working with Apple and with Google on their functionality to ensure that it can be consumed by the app to improve the app's performance.
On the app, will you be releasing the source code, and if not, why not?
Yeah, absolutely we will. We will be releasing the source code for everything that is safe to do so, and that's currently being assessed by the Australian Cybersecurity Centre. And as soon as they've done that assessment, we will make that source code available.
Do you have an idea, sir, of when you actually can release the source
within
code?
2 weeks is what we've said.
Can you rule out that intelligence services will build a backdoor into the app as allowed under the Telecommunications and Other Legislation Amendment?
Absolutely. So the biosecurity declaration that was signed by Minister Hunt completely rules out secondary use of the data within the app.
Just on Claire's question about people worried about it inadvertently stop running in the background, what kind of things are you doing to stop things like battery drain on phones of the app, and making sure that we don't kind of inadvertently turn it off? How are you fixing those kind of
So
bugs?
there's a few things in there. So the first thing is our testing indicates that the app, if you're already running Bluetooth, it only uses marginally more battery life than any other app. So if you're already using it, it's only a marginal increase on the battery drain of the phone. And if you're not, it's obviously equivalent to an application that uses Bluetooth, an equivalent application, such as Spotify or something that connects to, say, your car. We have enabled a push notification for all those people who have downloaded the app overnight to, I guess, remind people to run the app. So for those people who it does slip into the background, we know that the performance is better if it comes to the foreground of all the apps that you're running. So there's a reminder in there to allow people to then almost refresh the app's status.
Does the app stop working if you have too many different apps running with Bluetooth and location tracking at the same time?
It's quite dependent on the phone, the settings on the phone, the battery of the phone and the power of the phone. So what we see is that, the more things you have open, the more, I guess, interference that's possible within the signals of the Bluetooth, and the reduction in the Bluetooth strength, which also affects the accuracy.
There's been some concerns about the fact that it takes the app really works if you're around someone for about 15 minutes. Is there anything that can be done to reduce that time, and why is it currently the 15-minute time? Is it because of, as Professor Murphy's talked a lot about, it takes about 15 minutes maybe to catch coronavirus?
So actually, I might refer to Professor Murphy.
So you have to make a balanced assessment on that. Obviously, you wouldn't want to be capturing every brief contact. Our case definition, based on the epidemiology that we've seen around the world, that sort of level of time in a contact presents a much, much higher risk than just brushing past someone in the corridor. So we don't want to give the contact tracers a list of 1,000 phone numbers when there are 25 of them that are much more relevant in terms of potential contact. So those decisions are made on the best available epidemiological advice at the time.
Do we know what states are leading the uptake of the app?
No, we have, the Commonwealth has no access to any of the data. The data, we have locked this down so completely, so thoroughly, with a biosecurity rel, with legislation that's coming. The only people who can access the data are the states and territory health officials. All we are told is how many people are uptaking it, because we won't know anything about who they are or where they live, because we have a compact with the Australian public. This app will only be ever used by public health officials in the purposes of contact tracing. That's what it's for. It will never be used for any other purpose.
Professor, you've talked about the app complementing the existing work that the states and territories are doing. Are you able to speak to what capacity is there? I know that it's done at a state level, but do we have numbers?
Sure.
Compared to, say, a month ago?
So we think there is currently about 7,000 public health workers. There are multiples more than there were at the start of this outbreak. There was some big jurisdictions had a workforce that was well under 100 and are now several thousand. And so they have recruited a huge amount of new workforce. They've set up new call centres, they've set up new systems, and at the moment, because the epidemiology is pretty good and there's not a lot of contact tracing to do, they're training up those new recruits to make sure that we have this huge and highly effective public health workforce. So I haven't got exact numbers, but it's between 5,000 and 10,000 when I last looked, and I think around 7,000.
Professor Murphy, just on the active case numbers, how much is there of this virus in the community? And if there is not a high number, a substantial number, there appears to be along the latest study yesterday around about maybe 700 active cases across Australia. If there is that number there, is the risk of reopening and releasing restrictions low?
The risk, we will not release restrictions until that risk is seen to be sufficiently low that it's manageable. What
does that mean in terms of, you spoke about the trend before.
Yeah, so the trend, well, if the current trend stays as we are now, with sort of 20 or fewer cases a day, and very few of them being those community cases without an epidemiology link, that would put us in a very strong position. An even better position would be no cases in 2 weeks. So,
is it going to have to be no cases?
No, it doesn't have to be no cases. National Cabinet has endorsed a strategy of significant suppression. If we get elimination as part of that, which we probably are seeing in some parts of the country, that is fantastic. But elimination is never a certain situation, because you can never be sure. The fact that you haven't detected any cases for a week doesn't mean that there mightn't be some cases circulating. So you still have to have all of those public health response measures. But another question?
On the topic of elimination, the New Zealand Prime Minister says there are no undetected transmissions and that the country appears to have won the battle. Your Kiwi counterpart says that the goal of elimination has effectively been achieved. What's your assessment of that?
So, and I think it's a somewhat semantic difference between our situation here and in New Zealand is very similar in terms of per capita case numbers. They have certainly, because they're a smaller population, they've got very few cases at the moment, but they would recognise that elimination is a label, because you cannot be 100% sure that there aren't cases that you're not detecting. So you still have to do all of that surveillance, testing, and have all the response capabilities ready if you release measures. You can't be sure about elimination for many months until after you've released measures. So we're in a very similar position. It's a somewhat semantic difference. Both of us, both countries, are committed to really, really controlling the virus to as low as possible, and if possible, elimination. That's great.
Does that mean there won't be be a similar declaration in Australia if we get to that point of elimination?
Obviously, if we had no cases across Australia for a period of weeks, we could make such a statement, but it won't change our response.
Just in terms of testing of asymptomatic cases, when asked about it a few weeks ago, the Prime Minister said they would be doing it broadly because there was an issue with how many tests we actually had. Does this mean that now that we're considering testing asymptomatic cases, we're in a better position in terms of our stores? And also, would you be considering testing either children or elderly people as part of this expansion?
What was the last bit?
Would you be considering advising states to begin testing either elderly or children?
So, at the moment, on the first part, we have much more security over our test kit supplies. Minister Hunt's going to be making some more announcements about that in the coming days, but we've done a lot of work to ensure we've got better supplies so that we can expand our testing. We've already expanded our testing to everyone who has a respiratory illness. Anyone with a cough or a cold or a runny nose can now get tested. That was a significant expansion, and we really encourage people to do that. There probably isn't a lot of value in testing children or elderly people. The most important target for testing asymptomatic people are those who we know are transmitting the virus, and that's the young adults. So that's where we'll be largely going. But we've got to have a strategy that samples right across the community.
Professor Murphy, did the HPBC make any headway discussing the principled guidelines around community sport, other types of sport? Do you expect that might be completed by that 2 and a bit week deadline?
National Cabinet would like some advice within that deadline. We haven't had any discussion of it yet.
Could I ask you a question about the elective surgery ban? There's a lot of discussion in the medical community about surgeons who appear to have conducted operations that appear to be category 3. Would you be disappointed if this was found to be happening, and what action should be taken against anyone who's been through that?
Look, I don't have any evidence on that. I've seen some media reports. I'd be disappointed if people were conducting cases that weren't in that urgent category when we were pausing elective surgery, but I'd have to understand the circumstances. I think it's unlikely that action would be taken. The reason we stopped elective surgery was mainly to preserve personal protective equipment. We have pretty good stocks of that at the moment.
Professor Murphy, just in your summation of what you were saying before about the possible easing of restrictions, is it your view that if we maintain this trend over the next fortnight or so, when AFPBC and National Cabinet will next consider easing of restrictions, that you could look at a faster, what the Prime Minister calls faster road out? Could you look more soon?
I don't want to preempt the National Cabinet discussion and it's not just the local epidemiology, we've also got to assure the National Cabinet that our public health response is up to scratch. We think it's probably one of the best in the world. We want it to be the best in the world. So we've got to have that testing expansion that we were talking about. We've got to have all of the elements in place as well as the local epidemiology. So, and we do strongly feel that making too many changes too quickly could be risky. We've seen what's happened in other countries that suddenly had a problem that appeared that they didn't know about.
Given that, what do you say then for people who were seen gathering in very large numbers at beaches, parks, shopping centres over the course of
Don't. Any more questions? Thank you.
Thank you.